get the idea. Now, looking at these two procedures, both are 95% effective and work most of the time. But let's look at the very distinct differences between the two. Look at the difference in the scars between the endoscopic procedure on the left-hand side and the open procedure right here. Look at the difference, the swelling associated with it and the longer scar. As you can imagine, with the two procedures, the more minimally invasive, smaller scar has a much quicker healing time, much less scarring, much less pain medicine, much less therapy afterwards, and finally, it's just a Band-Aid over the incision compared to a splint for several weeks for the open procedure. So the difference in the two is dramatic in recovery time. About 4 weeks on the endoscopic, and on the more advanced open procedure, it's about 3 months. Now, 98% of the time when we do an endoscopic procedure, this resolves, or we can do it through that approach. About 2% of the time, though, we can't see what we need to do it safely. We're not going to take risk doing this. As a result, we convert it to the open procedure. You'll still have a good recovery, just a longer recovery. Usually with either of these procedures, the numbness and tingling goes away instantly. If you have loss of feeling, though, that can take months to know if that's going to wake up. And if you have weakness, that may be permanent. About 3 months after surgery, you can expect to have soreness in the palm. This is called pillar pain, where the ligament folds back after we cut it and you get soreness, as you can see here from this circle area graphic that shows the area of the soreness you should have. But eventually it'll dissipate. It's important to know that there are several reasons why you may not get complete relief, or you may get no relief at all. Number one, in a very severe case, very advanced case, the nerve just may not wake up after the surgery. This is a small chance. The second, and we see this too often, is a patient was misdiagnosed. The doctor gets a nerve conduction test that shows carpal tunnel syndrome, but in reality, it was underlying arthritis, and they didn't really have symptoms of carpal tunnel. They have the surgery, they don't get any relief, obviously. The third is a patient that has good relief of the symptoms initially, but goes back to typing 8 hours a day on the computer, and the symptoms come back. Finally, it's called a double crush syndrome. This is where you can have a pinched nerve in two places, the carpal tunnel, and very commonly a nerve in the neck that can have overlapping symptoms. You have the carpal tunnel surgery, you don't get complete relief because you still got to get your neck looked at.